Hello everyone, my name is Payal and I welcome you all to We Talk to You, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited, which was established by the National Dairy Development Board in the year 1982 and later registered as a company in the year 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine that was to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines, and currently we are the major player in human vaccines as a leader in anti-rabies vaccine segment and presence in around 50 countries. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. Human Biologicals Institute's vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We truly believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. We're very proud to share about our green initiative. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs of our flagship brand. As an organization, we take a corporate social responsibility quite seriously. Either it's adoption of government schools, where IL is providing midday meal program, and as a result of IL's intervention, the strength of the children in the adopted schools have been doubled within few years. In association with NDDB, through our gift meal program, over 2,500 children are benefited daily. And we're working towards a rabies-free country, starting with Thiruvananthapuram in association with FIAPO. So this were few information about Human Biologicals Institute. You can log on to www.indiamin.com for more information about it. So today we meet again with yet another session of We Talk Do You. And today's discussion revolves around a topic which is becoming quite common these days with women and which has a direct consequences in their ability to get pregnant. Well, many of you would know that women have a certain set number of eggs at birth, and that number gradually decreases once we get old. They say, the fact says that by the first period, most women have about 3 lakh eggs on an average. See, while it is very normal to have fewer eggs as we get older, but some women may actually have a less egg count for their age. Low egg count and getting pregnant is not impossible by any means, but it can potentially reduce your chances of conceiving. So why do some women have low egg count or poor ovarian reserve or diminished ovarian reserve? So the terms can be many and quite confusing. So there are multiple descriptions about it. So without any further delay, I would like to request and welcome our very special guest for today's show, Dr. Jyoti Kalikoti. Dr. Jyoti Kalikoti is a renowned infertility specialist from Chhattisgarh and a learned person, and but she usually speaks a lot about infertility and related issues. She has helped many women achieve the joy of parenthood. With this, I truly welcome, and it's a pleasure to have Dr. Jyoti with us today. Dr. Jyoti, a very good
Thank
evening and
you.
welcome, ma'am.
Thank you. Thank you. Namaste.
Namaste. So, Dr. Jyoti, I think you would be meeting a lot of women on your, your daily practice, where you would be seeing this issue as pretty common: low egg count or diminished ovarian reserve. So, before we actually get into the detail of what are the factors and what exactly causes this, can you give our audience a glimpse of what exactly do we mean when we say ovarian reserve?
Actually, ovarian reserve is like you're having a bank in your ovary. Reserve means something your ovary is having when you are taking birth. So ovarian reserve means the number of eggs we are born with. For to understand better what is ovarian reserve, we need to know some numbers basically. When we are in the form of embryo in our mother's womb, we are having almost 5 lakhs of our oocytes in our ovaries, both ovaries. And by the time we are born, it comes to about 1 lakh. So almost, and that period of embryonic age only, we are losing almost 4 lakhs of oocyte. After birth, till the age of puberty, this number further goes down. It's about 60,000 at around the age of puberty, that is around 12 to 13 years. Okay, and every month with the start of menstruation, it further goes down. Almost 40 to 50 eggs are every month is getting lost, and by the age we reach around 40 or so, we are hardly 100 eggs left in our ovaries. So actually what happens as we grow older, every month or every moment there is atresia of ovaries, or we can say that there is decline in the number. Some of the ovaries are getting wasted or lost. So every with advancing age, this number of decline is further aggravated. After age 35, the number of destruction of ovaries further go very high. So these all things are creating means with advancing age, our bank is getting is running lack of money, or our ovary is getting lack of oocytes. So ovarian reserve is something that is basically a very important factor for predicting the inability to, or we can say the ability to conceive also, we could rather say. It's basically predicts the ability of conception of women. But it doesn't mean if something is wrong or the parameters are getting down, a woman won't be able to conceive. It is not like that, because miracles happen every day in our life. So definitely it helps in counseling a patient and predicting our treatment. But definitely nowadays, with the revolution of everything, every day it is evolving, the science is evolving so much, it has become a very important part of infertility treatment to assess the ovarian reserve of a patient who is coming with the complaint of infertility. So this has become a very important point to understand and to counsel the patient what is ovarian reserve.
Great. Thank you so much, Dr. Jyoti. So to start with now you had mentioned women do have a particular set of oocytes or eggs in their
Yeah.
entire life. And there is certain point, like as we advance in age, the number of oocytes are diminishing slowly. And that is something, a stage comes where actually a women, like an old women in her old age, let's say above 35 or 40, so that's where the major cause of reduced ovarian reserve or diminished ovarian reserve is actually noticed. But since we are talking on low egg count, we currently these days there's a lot of cases where it happens even when the women has not reached the age of 35.
With
Women are facing this problem,
less egg for their ovaries.
right?
For the age, they had very less oocyte in their ovaries, basically.
Okay, so that is exactly what is the reduced ovarian reserve means. So
Exactly.
there must be something like there must be some factors, right? There must be some reasons or why exactly it happens. Like you mentioned, this is biologically functioned that women of older age group they do start reducing the number of eggs. But why does it happen with women of not so old?
Actually, there are so many factors which are associated with decrease of wind reserve. And if a person is having those medical issues with them, they should always think of that my ovarian reserve might
Okay,
get low in the near future also. So certain factors I would definitely like to point out is one of the factor is like obesity. I will enumerate few factors which are very much encountered these days. Obesity is one of the factor which is associated with very early decrease or the decline. The rate of diminution is very high in case of obesity. Actually,
okay,
though, in case of obesity, a lot of oxidative stress factors are released and that are causing very bad environment inside the ovary, leading to increased rate of decline in the oocyte. Second very important factor is smoking. Okay, so these are some lifestyle disease problems that are leading to poor ovarian reserve. Very important factor is endometriosis. We are very commonly encounter endometriotic patients. Even in the school going kids, we are seeing endometriosis these days. One more thing is ethnically also we are prone, like Asiatic women are prone to have early reduction in the ovarian reserve in comparison to Caucasian women. So ethnicity also sometimes poses a problem regarding poor ovarian reserve. There's so many other factors like if a woman has undergone some kind of therapies like chemotherapy, radiotherapy, or some kind of chemotoxic drugs are being given for immunological diseases like SLE and all. So sometimes these drugs are leading to poor ovarian reserve. One more very important thing is sometimes we people are genetically also prone to have poor ovarian reserve. Okay, like some genes had been identified which are leading to poor ovarian reserve, and identification of gene in a person can again point towards the poor ovarian reserve. One more issue very common in India is genital tuberculosis and
okay.
pelvic inflammatory diseases. So very common things which are occurring nearby can point out towards they might have some infertility related problem in the near future, and they can ask for even if they are not seeking for some fertility treatment. But such kind of things should come in mind, like if somebody is having endometriosis or some kind of treatment, like if some she has undergone some surgery for ovaries, like sometimes we do ovarian cystectomy.
Okay.
Okay, so a very common issue if a patient is having PCOD, they undergo ovarian drilling also. Some these are very common surgeries which are being performed, and that later leads to poor ovarian reserve. So there is n number of reasons behind poor ovarian reserve, and that very commonly encountered in our infertility practice, also in our gynae practice. Also, we commonly see such things, especially
Okay.
genital tuberculosis, PID, and obesity. These are very common in India, and these are all associated with the poor ovarian reserve.
Great. Thank you so much, Dr. Jyoti. So, like you have mentioned, there are basic. First thing that you had mentioned was the lifestyle factors. I think that is most common as compared to the other genetic mutations or radiation therapy or the surgeries. So
Yeah.
that is something that is up to someone to change. Uh, Now, Dr. Jyoti, I mean, there must be certain women, not everybody is looking to conceive at a certain point. Let's say somebody would like to conceive after a certain year and certain years, and but still, women, they need to consider certain fact or certain symptoms or certain signs that can help them to know if their ovarian reserve is depleting. So, are there some kind of signs or symptoms that a lady can know that she should go and visit a doctor?
Actually, ovarian reserve does not cause any signs and symptoms. Basically, signs that we can elicit definitely, but usually does not cause any kind of symptoms. Like, but some patient might come with a case of delayed cycle. Their
Okay.
rate of ovulation is less, so sometimes they come with a case of oligomenorrhea. But often, what I had told you, like they might come with symptom associated with the disease. Like if a patient is coming with endometriosis, she will have symptoms of endometriosis, like painful menstruation will be there. Okay, so by seeing the endometriosis by ultrasonography or by her symptoms, we can make out that she's having endometriosis, and she might have, in later her life, she might have problem related with the poor ovarian reserve. So usually they come up with the associated problems that comes with, that is ultimately leading to poor ovarian reserve. So usually poor ovarian reserve will not cause any kind of symptom to the patient. The only thing she might have less frequent cycles, like cycles may get irregular or maybe delayed cycle kind of thing may be there.
All right. So, Dr. Jyoti, now when a lady comes to you and who is actually looking out to conceive and is unable to and is dealing with infertilities, let's say they have tried for let's say 1 to 2 years. So,
Okay.
what is your take for that particular woman? How do you take it forward? Like any such treatment protocols that you suggest her once you know that she has diminished ovarian reserve. So what exactly you do? What kind of suggestion do you have for those women?
Actually, if you are designating a person with having poor reserve, needs some kind of investigation also. Okay, and some parameters are there to diagnose a patient to have poor ovarian reserve. Okay, so there are main three criteria which are there to define the patient might have poor ovarian reserve. One is the age factor itself is a very important factor.
Yeah.
If a patient is coming with infertility at later age group, if somebody is coming at the age of 24 or 27, we are at least not concerned much about the poor ovarian reserve. We are concerned about other things. But if a person is coming for the to seek advice for infertility at the later age, after 30 or after 35, the main factor which is coming, like we pinpoint maximal time about the her inability to conceive might be there with the advancing age. So age factor itself is a very important indicator for poor ovarian reserve. Second important factor is some investigations are there which should be done to diagnose a patient having poor ovarian reserve. Like ultrasonographic findings are there. We measure the ovarian volume. We are measuring some important investigation. We are measuring the number of antral follicle counting, AFC counting. We often talk about AFC counting, AFC counting. That is the ultrasonography done on day two and how many she's having that particular day. That is called AFC. So this is very important indicator. Very important third thing is AMH hormone. We all know people who are undergoing for infertility treatment, they often talk about AMH is very less, AMH is very less. So AMH is very important investigation. So two, three factors are there. AMH and AFC are the two important factors which has been included in the diagnosis of poor venerism. And third, very important factor is again, if she had history of previous treatment for infertility and she were poorly responding to previous treatment. So there's a three criteria to define a person to have poor reserve. One is the age factor itself. Second is her skin AMH level, and third very important thing is previous records showing her response to the treatment. So if a patient is having poor ovarian response, poor ovarian reserve, as per these three criteria, they should undergo treatment without any delay for infertility. So type of treatment will depend upon so many other associated factors that is leading to infertility. But we should always ask her to remove those modifiable factors for poor reserve, like if she can reduce her obesity, if she can quit smoking, if she's undergoing some kind of treatment, then she should know whether this treatment is affecting her fertility or not. So accordingly, she can take the advice for her future pregnancy and conception. Okay.
Great. Thank you, ma'am. Ma'am, one more thing I think many of us would like to know about it because there is so much of people have started talking about this, and many women these days, especially the working ladies, they have started opting for this option. So there is something known as fertility preservation, and
Yeah.
somebody who's trying to delay her pregnancy for a certain age, or somebody who has undergone certain surgeries that might
Yes.
lead to diminished ovarian reserve, doctors suggest they should go for fertility preservation. So Can you give us some insight about, though I understand it's a complete different topic altogether in itself, but it would be really great if you can give us certain insights about it, though it is certain really, I mean, it's very much related to our discussion today.
We all know the age of marriage in India is getting higher and higher every year. Moreover, females are also very much career oriented this day, so they want to plan their pregnancy and marriage also in later part, mostly beyond 30 and beyond 35. For those women, I would always like to tell they should give preference to their um, child bearing, because we can't play with nature for a very long time, in spite of
Yeah.
having so many fertility preservation type of treatment available, but everything has a very high failure rate also. So
Okay.
one should always respect the nature and respect the time, the age. So uh, for me, I think one should the carer should be the second option. We should always look to have a baby at right time so that we can enjoy life as per our aging. So but the thing is, if somebody is really want to have baby after 35 or so, second they or somebody is undergoing some surgeries for cancer, or somebody is going cancer chemotherapy and cancer radiotherapy, in all such situations, we can preserve their there's so many ways of preserving the fertility. One, I will again enumerate few things. One is cryopreservation of gametes. Like as we can preserve the sperms, we can also preserve the ovaries. For that, again, they have to undergo some kind of stimulation protocols, and the oocytes that are being retrieved surgically can be preserved for later use in their life. So, cryopreservation of the sperm and cryopreservation of oocytes is one of the important modality of fertility preservation. Second thing is we can preserve the embryos also. If a couple is undergoing some kind of treatment, so they can plan to undergo IVF and cryopreserve their embryos for later use. And third, very important thing is they can even preserve their ovarian tissues also. Okay, they can this ovarian tissue can be later on used for the ovulation induction. So these are very important modality of treatment, though so many things are under research also. So this treatment modalities are available for cryopreservation for those patients who are seeking some treatment which are very much gonadotoxics, and for people who are professionally planning for their pregnancy in later part of their life. But everything is having very high failure, right? Like all these treatment are not so simple, it's time consuming, and we can't like the rate of success is 40 or 50% or so. So they can think of about all these fertility preservation things.
Great. Thank you so much, ma'am. I'm sure all the points that you have described today would be of great help to people knowing about this. I mean, who wanted to know about this. I'm sure many of us, I mean, many of our viewers watching us today right now live and who will be watching this video coming forward would really benefit from what Dr. Jyoti has mentioned. Before we go ahead with the session, I would really like to request if you have any sort of question that you want Dr. Jyoti to answer, please put it in the comment section or you can message us as well. We would love to answer them. So, Dr. Jyoti, meanwhile, before we go with certain questions that would be coming from our viewers, is there anything else you would like to mention? You explained us in a very beautiful manner what is ovarian reserve and what are the factors associated with its reduction. And is there something that even before going, like you did mention one particular statement that you ask ladies to reduce weight and stop and improve the lifestyle, so certain lifestyle changes that you suggest. So any top, suggestion from you while we wrap up the session, that something this can be done so that ladies can ensure a complete full reserve of ovaries, I mean ovarian reserve.
Actually, what I feel, with growing pollution, there's so many factors which are not visible to us, and we all know sperms and oocytes are this two type of tissue are very much sensitive and susceptible to toxins nearby. Okay, so anything which can make our life better, like doing exercises, taking good diet, being stress free. So these are so many factors which are leading to less production of oxidative stress in our body. And definitely it is not just the number of oocyte, it is the quality of oocyte that is also very important for the pregnancy to happen. So we want not just good ovary, we want good number of oocytes also, and want good quality of oocyte also. For that, very important is we should have, as much as possible, we should clear those invisible pollutants in our vicinity or in our environment. So, and pollution has definitely, I think, there is a need for to research a lot many things associated with the decreased result, because these days we are having very young patients who are coming with 22-year age, and AMH is so less, ovaries are so small, very poor ovarianism at the age of 22. So what kind of treatment you will suggest for this kind of patient? They have no option left other than going for over donation. So, and with the legalization and the RT rules that are becoming very stringent these days, it's very difficult to get donors also. So to preserve ovarian reserve is very important by good diet, good lifestyle, quitting smoking, quitting alcohol, and reducing obesity. So I think lifestyle modification will definitely, at least it will help out in giving a good quality over or oocyte. So that is very important factor.
Thank you, Dr. Jyoti. Ma'am, with your permission, can we take up one, two questions that we have received in the inbox?
Okay.
Just a moment, I'll just open that. Okay, there is a question regarding, I guess, she wants to understand about the AMH test. What exactly, let me try to frame that statement. For testing egg count, is blood test required?
Yeah. Okay.
So,
There are so many tests available which can be used to assess the ovarian reserve, or how your ovary is gonna respond treatment for infertility. Okay. So the tests are there are 4 to 5 tests which can we can ask for, like serum FSH level, one of the hormone that is required for the recruitment of oocyte. Second hormone we can ask for is serum estradiol level, E2 level. Third is inhibin level. Fourth is your AMH level. But the best is AMH, serum AMH level is the best hormonal test that we are asking for. This can be done at any time during menstruation, but preferably done on the day 2 or day 3 of cycle. And AMH basically, it this kind of chemical substance released by the antral follicles that are being counted on the day 2 or day 3 of cycle, and this antral follicle basically release the image, and which is being assessed preferably on day 2 or day 3 of cycle. And if the image is coming less than 1.2 nanogram per ml, then it shows the ovary might have less reserve. And that is why it is a very important test included even in the diagnosis or even in defining the poor ovarian reserve. So most important test is image test, because there is no intercycle variations also. Like every cycle will ask for doing the image, it will more or less same. So image has do not have any intercycle variations, so very much reliable and not very costly also. So serum level is the best hormonal counting is very important sonographic cycle, and age correspond to the age level. So FC will hardly cost 200 rupees per patient in our area. So if somebody is not uh, able to pay for image also, we can just do an HC counting by doing transvaginal ultrasonography, and we can assess what is her ovarian reserve. So I think HC is the most important, predictive, and very cheap also to conduct. So HC, antral follicle counting, is also sonographically we count the HC. That is very good. Actually,
thank you. Thank you, ma'am.
we can't see the number of oocytes. We can't count our money in the bank. So these are the indicator, the image and FC. These are the indicators which will show how much money we are having in our ovary, how much money is in our bank. So we can't count the all oocyte. These are the window to see it, basically the image in FC.
Thank you, ma'am, and thank you, ma'am, for asking the question. Hope you are with us and you have heard the answer. If you have any more question, you can surely write to us once again. We have one more question from Seema. Seema asks that she has a 2-year-old son, and they are planning for a second child since 7 months now, but
Okay.
unable to. So does it mean that she is suffering from poor egg count?
It does not necessarily mean poor ovarian count, ovarian reserve. Actually, I need to ask her whether she's lactating or not, if she's feeding her baby or not. Okay, if she's feeding her baby, then sometimes lactating mother are having uh,
Okay.
like the chances of pregnancy is less when we are feeding the baby. So if she want to conceive, first of all she should give up the feeding to the baby. She will stop lactation and then should plan to get pregnant. Moreover, this gap is, I think, very less. This 2 years is very less gap, and she can definitely wait for some more months before seeking the doctor. And first of all, she should quit the lactation, then only she should plan the pregnancy.
Okay, thank you, Dr. Jyoti. Seema, I hope you are here. You can you can answer if what ma'am has just asked, or if you have some more question, you can please put up. Thank you, Dr. Jyoti. I think so far these were certain questions which were not repetitive. We thought of asking you. There were certain other questions you have already covered up in your session. So I think with this, Dr. Jyoti, we have really had a great discussion on this topic. I mean, we are seeing these days. Actually, we are like where we are getting a lot of queries in our website as well. These days, women have started discussing and talking about this particular topic. Many are searching about this. Like rightly said, even about the fertility preservation, many ladies are searching on that. Though you
Yeah.
had very clearly mentioned that that is certain option that you don't suggest your patients and couples. So it was really great and lovely discussing with you, Dr. Jyoti. It's always a pleasure to have you, and we as a team and the entire viewers will look forward to have you once again on the show.
Okay, thank you. I think this much knowledge must have helped so many people over there, and I always feel like we should never we all are playing with the nature only. So we should always respect nature, and everything should happen in time. I think marriage, having kids, everything should be in time, so that once we are giving birth to a baby, we have so many other responsibilities to brought them up. So everything should happen in time, so that by the age we are retiring, our kids should get settled. So having baby at right time is so important, I think. So age of marriage should be that, this also, if possible, should always should complete the family within 30 years of age. That is why, so that these all problems of ovarian reserve and such things should not happen with anybody's life. This is very. I had seen people, like, they're so disheartened when they come to our clinic. They come for infertility treatment. Now they are roaming from here to there, from one clinic to other clinic, and by the time they reach to us, now they're so. Whenever I see them, I just feel like crying along with them. So doing everything in time is the best way to preserve our fertility. So that is the best message a person can get from this interview.
Absolutely, Dr. Jyoti, very rightly said, and I'm really happy to meet such a compassionate and empathetic doctor. I'm sure all the couples that they are coming to you would really
They become so
be.
emotional. I to get associated with them so emotionally. Sometimes I feel like crying along with them. So this very painful thing to undergo. Many times the even the family and people don't cooperate them. So it's a
Yeah.
very pathetic situation these days. And the most the people who are coming in later age. like they're in 35, 37. Most of our clinic is full of people who are in their late age, so it's a very big problem. This poor one reserve is a big problem, and it is not like that. It is their ovaries working at their age only. The
Yeah.
thing is, we are late.
Very
Late basic.
rightly said. That,
Ovaries working in their pace only. Maybe a little bit fastened in their ovarian decline in their ovarian reserve, but basically at the age of 35, 36, 38, 40, this is not the age. This is naturally they are losing their fertility basically. So basically, we are running late in this race. So we need to catch our train as early as possible. I think that is the best way we can have a family.
great. Great, Dr. Jyoti. Once again, it was a pleasure having this discussion
Thank
with you
you.
today. Thank you so much, and I wish you a very good health and have a great evening, Dr. Jyoti. Thank you once again, and I also wish all our viewers a very good evening and take care of your health. Uh, if you want us to bring certain more discussions on any other topic that you would like to know from us, please do write to us. We'll ensure like we will try to conduct a session with a with leading experts of our country in the next We Talk to You session of ours. Till then, take good care of yourself and have a great evening, everyone. Thank you so much, Dr. Jyoti.
Thank you. Thank you. Thank you so much. Okay.
Bye. Thank you.